Good afternoon, everyone. Sorry, get your attention here. We just want to go over a couple of housekeeping rules really quick. Please silence your cell phones. And if you have any questions for the panelists, please put it in the app for this session because we will ask them at the end. Also, please be aware of the exits in the room, which is there one over here to your left, two to the rear, and one to the front. The restrooms are right across the hall from us, so they're close. And I also want to let you know that this session is being recorded. Welcome to the Female Blueprint Demystified. It is my pleasure to introduce the sponsor today, and that is the NEPA Alliance, the Apex Accelerator, and I'm pleased to introduce Kara Smith, who is the Government Procurement Program Manager. Welcome, Kara.
Thank you. Thank you. I also want to say, I'll give my whole spiel, but we do have a booth out front if you guys would like to come speak to us and learn more about what we do. But we are a nonprofit economic development organization. We assist small businesses across 7 counties, and we assist them in a myriad of ways. We assist with business finance, government contracting, as well as international exporting. So again, if you want to learn more about what we offer, what we do, you could stop by our booth. We'll be here probably till about 5:30. But I want to also thank all the chambers and everybody who's involved with this event, and we are such a proud sponsor. We want to thank them for allowing us to be a part of this, as well as being a sponsor this year. So thank you so much to them, and I will get it over to the host. Thank you, guys.
Hi, good afternoon, everyone. I hope you are having a fantastic day so far. I think it's been a great conference. The chamber staff has done an incredible job putting this together. And I'm really excited to be here for a panel discussion on the Female Blueprint Demystified. Before we get into that, I'll introduce myself. I'm Jennifer Davis. I'm Director of Design and Development for Sordoni Construction Services, which is a construction management, general construction, and design build firm in Northeast PA. I'm also the board president of SLIBCO, which is the Scranton-Lackawanna Industrial Building Company. It's the industrial and economic development affiliate of the Greater Scranton Chamber of Commerce. So today we're going to be talking about how to increase your metabolism, balance your hormones, and conquer emotions, 3 big topics. Our 3 panelists here, I'm going to ask them to introduce themselves in a moment, really each bring a wealth of expertise and knowledge to this discussion today. So they'll be sharing some valuable insights, debunking myths, and provide some really practical strategies to empower us in all facets of our lives. So let's meet our panelists. We have Patricia Cummings, Dr. Barabara Plucknett, and Christie Estadt. And why don't we start with you, Tricia?
Sure. So I'm really thrilled to be here today. We have worked so hard on this program, and I'm so glad to see all these women. My name's Patricia Cummings. I'm a psychotherapist, and I have a private practice in South Abington Township. I'm also a certified trauma yoga instructor, and I also run women's retreats, both locally and internationally. So I have a retreat coming up in Greece in September. So that's me.
I am equally thrilled to be here. What a great day. I'm Dr. Barabara Plucknett. I'm a board-certified gynecologist. I'm also fellowship-trained in integrative medicine, and I have what was a private practice but recently aligned with Wayne Memorial Hospital. We actually live right next to one another in South Abington Township, so we'd be glad to see any of you come on up and join us there.
And my name is Christie Estadt. I've been in the fitness industry for over 30 years. So I can see some of you have done step aerobics with me, or high-low. For those of you who don't know what that is, I guess you're not in your 50s yet. I have had every certification. Right now, I primarily use my CHEC certification, which is Corrective Holistic Exercise Kinesiology, and my Functional Nutrition, which is Functional Nutrition and Metabolism. So basically, I can meet with you, analyze your posture, analyze your blood work, analyze everything, and come up with a complete plan.
Fantastic. So our first topic that we'll discuss is misconceptions about women's wellness, right? We're all inundated with messages about our health, whether these come from social media, from friends, from well-meaning family members, and it can really be overwhelming. So I'd like to ask you, from your perspective, what are 2 to 3 common misconceptions that might hinder women's understanding of their own wellness? Christie, I'm going to ask you to kick it off from the metabolism and fitness point of view.
Awesome. So, of course, this is near and dear to my heart. So, of course, you think I'm going to tell you, eat less, exercise more. To be honest, that's usually not the case. So I want to talk a little bit about men and women. So we have our male counterpart. We have us. We both go on a nutrition plan, a diet, so to say. So the guy, what does he do? Cuts out maybe some beer, maybe some chips, loses 10 pounds in 2 weeks, right? What do? We go cardio. We go kill ourselves. We eat less. And what happens? Zip. Yep, or you gain weight. So, metabolism is very complicated. There are processes, and as women, we're complicated. So it's not only what you're exercising, what you're doing, it's the processes in your body. So your organs, your hormones, and the enzymes that act on your hormones. So we need to look at the whole picture. We need to debunk the myth that we need to go out there and do 5 hours of cardio and eat nothing. We need to eat and we need to exercise, but we need to do what's right for ourselves, for each person individually.
Thank you. Barbara or Tricia, would you like to?
I'll dovetail on top of her statement, because one of the things, I brought up 2 of the topics that I hear hands down all of the time in my practice. The first one I'll hear is, does everybody in menopause gain weight? Why do I gain weight when I'm menopausal? And it's more of a, no, you don't have to gain weight in perimenopause or menopause. It is a part of the problem is our metabolism will start to slow down. And, at this age group, 40s, 50s, and beyond, our muscle strength isn't what it used to be. Our dietary intake may not be what it used to be. Maybe we aren't as active anymore. We're not out and doing things. And so it really is not something that's inevitable. We need to rethink how we do things. And we can change the types of foods that we eat, or the type of exercise that we do, or things of that sort. But it really is, how do you fix your metabolism? Not so much to plan on just gaining the weight. And that goes along with Christie's, let's get our muscles building and work on all of that piece.
So that brings it back to me. What we like to say is that I'm kind of the missing link with this whole program. What are we told to look on the outside first, right? Look at our body. We have to exercise more, just like Christie said, and watch what we eat. I'd like you to rethink your wellness and maybe look to the inside, because it's all one big package. And if we are only looking at the outside piece, which is very important, and not looking inside, looking at what has happened in our life, what are some of the experiences we've had, how have we reacted to those experiences? How have others around us reacted to our experiences? What have people said when something pretty big happens to us and then folks say, oh, that's no big deal? What do? We push those emotions down, and those emotions just sit in your body. So I think it's a big misconception that we only have to look to the outside. We need to look inside and look at our emotions and how all of these things have affected us throughout our life.
Thanks, great answers. Is there anything any of you have seen, maybe on social media, that you think, boy, I really feel like that's misinformation that gets shared with women?
Almost everything.
Almost everything? Okay, so I think the message here is, right, think critically and what the source is.
It's a rabbit hole.
Information.
If you're on social media, it's a rabbit hole. You're going to go down it. I mean, I've had clients come to me and start taking a pill because they thought that's what they needed, and they gained 10 pounds. So if you're looking on social media for answers, you're not looking for you're looking for what somebody's trying to sell, usually.
Thanks. Yeah, and go to the experts, right, who understand the science behind this. So next, kind of building on what we were just talking about, changes in women's health, maybe across different life phases or decades. Can you walk us through some of the changes women might experience or expect in different phases of their lives? Tricia, let's kick it off with you.
I'll kick off that one. So when I'm looking at the lifespan for anybody, but specifically women, children are survivors. So no matter what happens to us throughout our life, children have this incredible ability to just forget about it, push it away if it's really uncomfortable. And if we have caregivers who understand emotions, we can, when difficult things happen, our caregivers help us to explore that and say, wow, what was that like for you? How do you feel about that? But does that happen? No, I mean, none of us are really taught this type of thing. So what do we do as kids? The brain wants what's safe, that we push away those emotions. The problem that I see in my practice is that as we get older, all of those emotions that we've pushed down into our toes, start getting really heavy, really, really heavy. And I start to see women coming into my office, 30s, 40s, 50s, with increased anxiety, increased depression. And we'll get into some of the biological reasons for that, but I believe a part of that are all these emotions you've pushed down to your toes. I had a professor in grad school explain it to me like this. It's as if we all have a backpack, and every time something happens to us, there's this brick, and we take that brick, and if we don't deal with that brick and get rid of it, that goes into our backpack. As you're going through the years, that backpack gets pretty damn heavy, right? It's brick after brick. All of a sudden, you're 50 years old, and the weight of that backpack is just, it's just unmanageable. So it's really important to understand that and understand we need to pull out those bricks. We need to look at those bricks. We need to look at those bricks and say, wow, this is a bumpy one. I need to process this, I need to go through this, and I need to get rid of it to make that backpack lighter.
That's great, thank you.
So of course, it's all about the hormones, right? It's all about the hormones. And you know, when we start in our teens and we have hormonal imbalances and we get 20s and 30s and we think things have straightened out a little bit, but then again, mid to late 30s, they start to imbalance again. 40s, it's a free-for-all, and by 50, quote-unquote, average age of menopause is 51. The range starts 45 to 55, but I'll tell you, perimenopausal changes can start in your 30s. And so one of the things that we start to notice about our hormones shifting is a hormone called progesterone, which traditionally just starts to decline someplace in our 30s. And that progesterone hormone is the hormone that's responsible for our mood. And so a lot of times, what I see coming in my door are folks that have incredible anxiety disorders. And you know, their primary care doctor wants to hand them their Prozac and their Zoloft and their Xanax. It's their favorite. And I had a professor who once said, you know, nobody has a Prozac deficiency. Why are we giving people Prozac? They aren't actually missing their Prozac. Why are we giving it to them? But the bottom line is your hormones have shifted, and nobody knows to ask you, are you sleeping? How's your mood? How are your periods? And these things have transitioned over the years, and they'll go from a reasonable level right on down to the bottom. And so there are things that you can do to manage those shifts, but I think the first part of it is acknowledging that it could be your hormones that are off. And then bring in, you know, help with, well, let's talk about it, or how can we work through that with nutrition and exercise. But getting the testing done is the most important part to get us started.
So I can piggyback off both of these guys. So everything starts in the brain. So it's going to start in your hypothalamus. It's going to go to your pituitary. It's going to go to your adrenals. It's going to go to your thyroid. So it's all connected. So what starts in your brain is going to affect everything. Then it goes hormonally. So that at hormone levels, then it starts affecting your metabolism. So when we're in our 20s, the buildup is small, kind of like bricks, right? We're going to keep building these things up. If we're not doing anything about it in our 20s, and by the 30s, it's going to build more. So in our 20s, we can pretty much get away with anything. 30s, not so much. By the time you're in your 40s and you're going through, most of us, perimenopause, well, I'm past that, but anyway, it just starts to build and build. By the time in your 50s, you can't exercise, you can't do what you did in your 20s. So a lot of my 40s and my 50s, I'm telling you, are you getting steps in? Are you resistance training? So we need to exercise, we need to eat correctly all the time. If you start in your 20s and you eat right the whole time, you're going to be good, but that's not what usually happens. We usually get in a place in our life that we're so busy, we're not doing either one, right? So there are ways to get around that, but just knowing that don't think you can do the same thing as a 20-year-old and get the same results, because it will not happen.
So we talked, as we were getting ready for this panel, about kind of understanding what your body needs at a certain time, right? Christie, you talked about, right, maybe you can't go running that day. You can try doing something else, right, to move your body. Can you expand on that a little bit?
Sure. So, you know, the body's a complicated system. So, you know, if your cortisol is high and you are going and you're stressing it more, so if somebody comes to me and they're under so much stress, I think one of the questions was, you know, how do I de-stress working 60 to 80 hours a week? What do? Stress, exercise is stress. So if I completely throw on top of your stress more stress, what's going to happen? It's just, you're going to fall apart, pretty much. So it's about finding ways to do things to make you better.
Thank you. We're going to talk more about some practical strategies in a little bit. But another topic that was interesting to me was defining health that might be fine versus optimal health. So, right, we've probably been to visit a healthcare provider. Maybe we have some blood work done and we're told everything is fine. I'd like to hear from the panel on how we could differentiate fine from what could be considered optimal. And why is it essential to really strive for optimal health rather than just what's fine? Barbara, I'm going to ask you to start with that.
Yeah, it's one of my favorite topics. So what does fine mean, right? So if your provider has checked some lab work, and your level's in the range, you're fine. But to me, we have to look at a couple of different things, and I'm going to use thyroid as an example. So optimal means that you are at the best point you can be in that range for the problem that you're having, right? So I don't just order labs to order them. I order the labs that I think will give me the answers to solve the problems that you're having. So let's talk about thyroid. It's a favorite test that people like to get done because, quite honestly, if we are talking about weight gain, what's one of the things we want to know? Is my thyroid okay? So you go to your regular doctor and you ask them to run the thyroid tests, and they check a TSH. It is one of the worst screening tests out there. Why? The range is so broad. It goes from 0.1 to 4.5. It's a crazy broad range, and most endocrinologists will tell you that less than 2.5 is better. But we also know that TSH as a screening test is a lousy test, and we probably shouldn't even be using it as a screening test. What would be more appropriate would be to look at the actual thyroid hormones being made by your thyroid, looking at those ranges, and then getting your number to be optimal in that range, which means it should be at least halfway in the range or better. And then that becomes a very individual thing, right? It's not about the piece of paper that's in front of me that tells me whether the number is optimal. It's about how that number correlates with your symptoms. Do you feel optimal? Do you feel like we've achieved the goal that you want to achieve? And I can use that same statement for my hormone therapies, for all of the other labs that we look at. We know what the sweet spot is, but I only use paper to keep us safe. I really use the paper to give me guidance as to what would be the best therapy to optimize your health. And that's what optimal really means. Fine means nothing. What does that mean? I'll use one more quick example and then I'll move on. Vitamin D, big topic, if you can even get it covered by your insurance company. The vitamin D range is 30 to 100. And if you're 30, you're fine. But what does that mean? Does that mean you're getting enough adequate coverage for your bone support, that your calcium stays in your bone, that you're sleeping better, that your immune system is great? No, it does not. You really need optimal is at least halfway in the range or higher. And again, the paper keeps us safe. We don't want you at 101 either. But you have to understand what these ranges mean and how to use them to make your health optimal, and that's why we get blood work.
So what are some key questions we can ask our healthcare providers to kind of move in the direction of optimal health?
Yeah, so I would actually ask them, what do they think is the goal for you? You want a specific question about your health. What are you trying to improve upon? Again, they're going to look at your cholesterol level, and the range cuts off at 200, you're 201, you're fine. Well, what should I be? And how can I strive to be better? And what might I do with my diet and my lifestyle to get to that point? I don't want to be 201. I don't want to be 199. But I might want to be, what's the goal? 150? But how am I going to get there without the drugs that they might want to hand me? So you really want to know, you want to ask the question, where should I be? What would be the best place for me to be if you don't have symptoms? If you have symptoms, you want to know how to get rid of the symptoms.
Thank you. Christie, Tricia, would you like to add to that?
Absolutely. So in my world, what is fine and what is optimal? Do you get up every day and want to get out of bed first? Do you want to exercise? Do you have that energy? So for me, it's about an advanced biofeedback screening. So, learning where you are, where you want to go, and how we get you there. So everybody is not the same. You can't have the same exercise program. You can't have the same nutrition. You really have to develop a plan that's made for you to make you feel optimal and not just fine. I don't want you waking up feeling fine. I want you, right? How do you feel? Fine, 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 right? No, we feel great, and that's why I want you to feel.
So adding on to that, how do we know that we're fine or optimal? Part of that might mean stopping, tuning into our body, and noticing what's happening. So we are all so busy. We have a lot of professional women in the room, and what are we doing? Women are caregivers. We take care of everybody else, and we put ourselves last. If you want to be your optimal best self, you need to put your own gas mask on first. You need to be in a good place to care for everybody else around you, to care for yourself. But what does that mean? That might mean stopping before you eat your lunch and checking in. What's going on? How do I feel? Stopping for 30 seconds may alert you to the fact that, oh my gosh, my shoulders are up at my ears. Everything's really tight. Or my heart's beating outside of my chest. Maybe you didn't even notice that. And just like Christie said, how do you know when you wake up in the morning, if you get up, the alarm goes off, you get up, you go for a run, you make breakfast, you get out the door. What if you stop after that alarm goes off and just go inward, just for 30 seconds? What's going on? What's going on with my body? How do I feel today? And then we can get to the questions and talking to your providers.
Thanks. That's a really good reminder, right, to just pause and check in with yourself. With that, let's talk about some other practical strategies that we can implement, right? Lifestyle changes, self-care practices that we can implement to manage our metabolism, to manage our hormones, our emotions, considering the interconnectedness of those three things that we talked about. So can you each give us a couple of things that we can each do immediately? So when we go home tonight to our families, or when we go to work tomorrow, or that we can do over the weekend, where would you recommend starting?
I'll let Barb start, because I know we're both going to overlap here.
Chomping at the bit here. I'll try to keep to the hormone piece of our very overlapping puzzle here. So the one thing that I would encourage people to really put some time into is your choice of food. And why do I say that? So I want you to eat whole, recognizable food. I want you to focus on protein, vegetables, and I'm going to dive off and say I want you to focus on things like cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, and cabbage. Why? Because that helps you with your estrogen levels. It helps your liver move your estrogen, okay? I want you to think about the food that you eat that doesn't weigh you down. Those are somewhat easier things to do than having to be on a diet, right? I joke because the one question that we did get on the app was that, this very busy person wants to know how they're supposed to try to make all of this work. And the one thing I will tell people, being one of those busy people that really has a hard time getting everything to work, is that the only thing that I have control over in my day is what I put in my mouth. I don't have time to exercise some days. I don't have time to get enough sleep sometimes, but I do have choices over what I eat. And I try to make it good, clean food that I feel will make me feel better. So protein makes me feel better, gives me energy. Vegetables make me feel better. Carbs make me feel lousy because it makes me tired. So I do try to focus on food that makes me feel better and have energy to keep going and doing what I do. And I feel like I do have control over that, where I don't have control over other things in my life. The environment plays a role in our hormones as well. If we use a lot of plastics, we microwave plastics, we eat out of plastic, we drink out of plastic water bottles, we microwave our styrofoam, we leach chemicals out of those things that look like estrogen in our body and confuse our bodies that we have too much estrogen. So I think that cleaning up our environment and getting rid of the plastics and things of that sort, and hormones in our food, will also help us with our own hormonal balance.
There's a website called EWR, which you can actually go on and look at clean versus contaminated. You can look at your water, you can look at the plastics, you can look at everything. So it's your cosmetics, everything you put on your body. So, sorry.
No, it's a good
you
one.
You can finish.
No,
I know you're not done yet.
No, you can keep going.
We can skip around.
Yeah. Are we going to go to sleep next?
Yeah, let's talk about sleep.
Sleep. So my biggies are, sleep, stress, exercise, your recovery, your digestion. Are we going to the bathroom regularly? I mean, do you poop? It's a big question, because if you're not, there is something in your gut that is throwing everything off. So, whole foods, again. Probiotics. There are different probiotics for different reasons. So I was just going to say, if you're constipated, there's a good one. If you go to the bathroom too much, there's a good one, but there's one in the middle. So there's always an answer for, and I like to throw a pill at everything, but that's something that's one of the big five. So sleep. Let's go back to sleep. I'll let you take over, 'cause she loves this.
I do like sleep. So sleep is a very difficult thing. I make my lists in the middle of the night, right? I get most of my work done in the middle of the night when I'm not sleeping. But the goal is to sleep. So what I want you to do tonight when you go home is I want you to look at your bedroom, and I want you to work on your sleep hygiene. That's what they call it, right? So your bedroom should be cool, dark, without a TV, without a computer. It should be either quiet or have white noise, something to help you focus on your sleep. You should allow enough hours for sleep, and you should try to keep to the same sleeping time periods every day, regardless of working, not working. So you should have patterns to help you sleep. If you really struggle falling to sleep, there are many things that you can take supplementally. Melatonin's the big one, right? But there are very many other safe supplements to encourage your sleepiness. If you wake up, there are other supplements. There's a delayed release melatonin. There are things that help you later in the night. L-theanine is a nice amino acid that when you wake up, your brain doesn't just start making your lists. But there are lots of things to help you with good quality sleep so that the next morning when you wake up, you do feel better. You're not just fine. You have more energy. The alarm doesn't startle you. You hit the floor running. But sleep is a huge piece of our hormonal puzzle. There are two main hormones that reset overnight. And if you don't sleep, they don't reset. Cortisol's one, growth hormone is the other. We need both of those to be adequate for muscle building, strength, energy. But if we don't sleep, we can't reset those two hormones. So it's important, not just from how we feel the next day, but for our overall body.
And there are two nutritional elements to go along with that too. So one, if you're not eating enough, and I'm saying this because 90% of the women that come to me do not eat enough, it's going to affect your sleep. So it's going to throw everything off. The other thing is if you eat too close to your bedtime. So you should have at least 2 to 3 hours before you go to bed for the digestion to occur so it does not wake you up at night.
I know we didn't discuss this prior to that, but the concept of intermittent fasting, right? Something like that. What is the science saying from your perspective?
There's lots of science. Most of it's good. However, if you are not getting the nutrients you need, I don't care when you eat. You've got the number one thing is you've got to get those nutrients in your body. Time restricted eating. I do it. It helps me tremendously. It gives your body time to reset. So, but again, you got to get the basics in first. You can't just jump right to intermittent fasting and think that you're going to lose weight, because you're not.
Great. Tricia, some practical strategies.
Sure. I mentioned just a couple minutes ago about stopping and noticing what's going on. How the heck are we supposed to do that with our schedules? Taking care of everybody, including ourselves, working. Our days just go, we're on this hamster wheel. We're going and going. So with my clients, one of the first things I ask them to do is to set a reminder on their phone for just a 1-minute stop. For some folks, that works when they wake up, sometimes when they are going to bed. Some folks in the middle of the day, it works for them. Just stop, like I said before, and notice what's going on. Additionally, we need to start as women to say no before we say yes. And I'm going to include your family and friends in that, because women say, okay, yeah, I'll do that, and then, I can't believe I have to go pick up my son at midnight, but I'm so tired, I have so much to do. There is nothing wrong with, and this might save your life, saying no and saying, no, you know what? You're gonna have to find a ride, because I need my sleep, because I can't care for you if I can't care for myself. So there's nothing wrong with saying, I'll get back to you on that if you need to think about it, okay? And then I'll add one more there if we have time. With this program we're running, I run a group that is connecting your body and mind and eating. So maybe joining a group like that, taking part in some yoga, which is really a moving meditation, connecting mind and body. Join a women's group, connect with other women, because we're all struggling with the same things.
Thanks, that's really helpful advice. Another thing we talked about getting ready for this panel was, right, women, we're trying to do a lot of things at once. If we drop the ball on something, the guilt that we feel. Any strategies or tips for dealing with that, getting past it?
Well, I'll start with this, because as a yoga instructor, I am very tuned into the chakras. And women are often surprised when I say, hey, you know that right here, you know where we all kind of gain weight in our belly? You know that's the sacral chakra? Do your emotions connect to the sacral chakra? Shame. And what are women? Women are shamed. You're not thin enough. You're not working hard enough. You're not the perfect mom. You're not the perfect friend. If we can't deal with the inner workings, we can't deal with that sacral chakra or shame, you can forget about it. You can exercise, eat, whatever. You need to deal with what's going on the inside for everything to work smoothly.
Would you like to add anything to that, Barbara?
No, I think
Or
that
Christie?
was well said.
Well, the guilt on my end is, I feel like I should have a confession booth in my office, because people come in and, I was so bad last night, I ate this, I ate that, and I'm like, okay, what are you doing today? Did you get back on the track today? You can't live based on what you did yesterday. The guilt of, I got up, I was too tired to exercise. Well, if you were too tired to exercise, you really shouldn't be. Go for a walk, take yoga. I want you to move, of course, but again, I don't want you to put more stress on your body. So the guilt, the guilt is real.
Yeah, so tune in, listen, right,
Listen
and
to
make
your body.
adjustments
Yep.
as we need to. That's good advice. I think we have some time now to take some questions from our audience. Do we have questions that have come in through the app? I know there were a couple before we even started the session.
And I think you've addressed a few of them already, but the first one is, are there any supplements or vitamins proven to balance hormones or promote emotional well-being?
So I'm going to take this one. The supplements, I like to think of supplements as adding to what you already do. It's not
Supplement.
the place, it's not to take the place of. So from a hormonal balancing piece, there are supplements that will help you with certain parts of the hormones, but you need to know which hormones you're trying to balance. So we can guess that your progesterone level is starting to dwindle, but I would rather not guess, I would rather know. And then yes, I can make recommendations on supplements that might help you level things out. We can guess that some people's estrogen level might be higher. Again, I can make another recommendation for a supplement, but I think the bottom line is you need to have the lab work so we have some place to start. As far as the emotional well-being supplement, I go back to what's the cause of the emotional well-being? We have sadness, anxiety, depression. We have different methods of emotional unwell-being, and we really want to know, where does that come from? We do treat them differently. You know, we mentioned that adrenal adaptogens, they're a stress adapter. The whole idea behind a Chinese herb is, for adaptogens, is they adapt to your situation. If you're hyper, they give you more. If you're low, they give you less. They kind of help level you out. But again, you really want to know what's the cause of why you feel the way you do. It's not your Prozac deficiency, so we're not going to give you that. But again, meeting with people, chatting, getting an idea of where we should start, certainly there are supplements that can be added, and they are proven to help.
Just building on that a little bit, Tricia, what questions could we ask ourselves to know what some of those underlying emotions might be?
So there is a quick meditation that I do with a lot of my clients, and it goes something like this. And this is, if you're thinking about taking my advice and stopping, when you stop, just go to a quiet place and kind of ground yourself. And by grounding, I mean feel the ground under your feet. Feel the chair underneath your bottom. Your hands, maybe your hands are on your pants. And just tune into your body. Because if I said, how do you feel? You say, oh, I'm okay.
I'm fine.
I'm fine, right? But if you're stopping, and maybe everyone can do it here, just kind of tune into your body and notice what's going on in your shoulders, in your chest, in your belly. Is your body sending you any messages? Is your heart beating fast? Is it kind of moving in a circle? Or is it stationary? Is it heavy? Is there an emotion you could tie to that message your body's sending you? Maybe not. That's okay. We're just noticing without judgment. So tuning into your body and just listening. If you're doing this day in and day out, you may notice some patterns. You may notice that doing this, you're saying, oh my God, I can't believe Tricia had me do this. I hate this. Well, guess what? That's a message. Why do you hate it? Why do you hate stopping? Why do you hate taking 1 minute a day for yourself to tune into what's going on?
Thank you. Next question.
Okay, the next question. Tips for breaking the stress, inflammation, metabolic syndrome chain, especially when you're on salary and working 60 to 80 hours a week.
I think a lot of those we answered already. I mean, we're all in the same boat. We're all, most of us, working too much. So taking the time for ourselves, taking care of ourselves. I know when I'm under a lot of stress, I really do go back to food. Food is the biggest drug you can put in your body. Mm-hmm. So if you're stressed out and you don't have some type of plan for your food, you're screwed. You're just going to feel worse and you're just going to go downhill. So you're getting into that routine of healthy eating, whole foods, moving your body, and finding time for it. So
Okay.
a lot of my stressed out women, I'll say, what do you do on your lunch break? Can you go for a walk? Can you just squeeze something in somewhere? 10, 15 minutes a day is better than nothing.
Do you have any recommendations for like quick things to grab if you're in that cycle of not enough time to, right, maybe cook a healthy meal, you just need to grab something quick?
It's tough around here. Like, this is not an easy place to do that. I mean, bars, not great. I mean, do I do protein bars? Yes, because they're convenient. Is it a go-to to make me feel better? Absolutely not. Protein shakes, do I do them? Yes. But I also put berries and greens and all kinds of very healthy things in them, so I have them all the time.
So back to the whole foods.
Whole foods.
Yeah, okay.
Well, I want to bring up something that we were chatting about earlier in the same vein of the busy but whole food people. I also heard the salary piece of that question, so I need to keep that in mind. I think that I'll use Wegmans as an example. They have things that are easier to make. They're chopped up, they're cut up, they're already in a pan. They're quick fixes that if you didn't have time and you had a couple of those things around, they also have frozen little bowls of food that are reasonably priced, that when all else fails, you cook it on the stovetop like Grandma did, you don't put it in the microwave. But they have food that's already made so that if you have some things in your backup pantry, freezer, or otherwise, that you can go to when you are just so pushed for time, so that you're not grabbing some crappy something on your way home. If you know you have something at home already, you won't stop at the fast food place or the other place and grab something you shouldn't get, piece of pizza, hot dog, whatever you think. You just have to have a backup reserve of food you like. You want it to make sure you like it, because it's a reward to eat good food, but make sure that you have stuff.
That's great, thanks.
All right, we have time for one more. So I kind of searched through the 9 questions that were in here, and this is something that wasn't touched on. What does the current research say regarding PTSD and abuse? With 1 in 4 women having experienced domestic violence in their lifetime, is there a factor in women and cardiac disease and/or metabolic disease and/or lifespan?
Ooh, that's a lot.
Wow.
That's a lot.
That's a heavy question.
Maybe
one,
I'll start with something. I actually was just listening to a podcast by Gabor Mate. He's a very famous psychologist, and he was talking about immune disease, so I'll use that. And he was talking about immune disease in that if you're looking at immune disease, he said, and you back me up if this is wrong, he said 78% of immune disease tends to be in women. And so we have a lot of immune disease. And there's a lot of research connecting immune disease with caregiving others before yourself, not expressing healthy anger. Because what are we told? Oh, you're not allowed, you're a woman, you can't show your anger. Get it together. And it's really important to understand this and understand if we're not tuning in to ourselves, it can hurt us biologically. And maybe you can, I don't know if you have heard that same thing, because I'm not a doctor, but I always kind of keep that in mind. And there's a lot of PTSD out there, and I think what we've thought of as PTSD with the veterans coming back, I actually have been diagnosing PTSD. I mean, I can't believe how much I diagnose it now, just with folks who have been through not taking care of themselves and been through not big T trauma, but just little trauma, emotional neglect throughout their life. And it just has a really big effect. Not sure if I answered that question, but.
That's kind of a loaded question.
It was a very loaded question.
Yes.
Very
yes.
heavy question.
I'm glad she took it.
Yeah.
All right, for the sake of time, because we are almost finished for the day, we do have some closing remarks this afternoon from one of our sponsors who is actually sponsoring our networking event. So I'm going to introduce Rose Kelly from ESSA Bank to give us our closing remarks for this afternoon.
Great, thank you.
I just want to thank everyone for attending the 2024 Empowerment Leadership Conference. My name is Rose Kelly. I'm from ESSA Bank and Trust. and I hope you had as a wonderful day as I did. ESSA Bank is proud ESSA Bank is proud to be today's Network Mixer sponsor, which we now invite you to. Please join us in the vendor marketing place to close out the day with some drinks and refreshments. Thank you.
Great. Thanks, everyone.
And once again, a great big thank you to our panelists and our moderator today, and to our sponsor for this session, which is the NEPA Alliance Apex Accelerator. You should all have your drink tickets that came with your name badges today, so use them to go out and network and have a great evening.
Just quickly want to share that our panelists will be here for a couple minutes if anybody has other questions that weren't yet addressed.
Thank you.